Osteoporosis and osteopenia. Osteoporosis and osteopenia are very common in Western society. Small children can be born with genetic defects, processing defects that can cause osteoporosis. There are certain conditions that are unfortunate, but those children's bones are very, very brittle. Anorexics, bulimics, can also suffer from osteoporosis because they're not getting the nutrition that they should be getting. People who don't get enough sunlight and they don't have enough vitamin D, the body isn't processing the building of bones. By far the majority of osteoporosis in the world is a lifestyle disease. Now, perhaps you haven't heard this before, but it's quite so. If we look at cultures where people, particularly women, work physically in the fields, lifting, moving, physically working, we very rarely find osteoporosis in those societies. So it's a mainly Western lifestyle disease. Your body has a system to counteract acidity. It's a deposit of minerals. It's your bones. That's what they're used for. They have two uses. The first use, well, they have a few uses. Their first use is that they are to structure the body, to hold the soft tissue in certain positions. Also, your blood cells are produced in the bones as well. But your bones are also a reserve of alkalizing minerals to counteract over-acidity in the body. And acidity in the body can happen for many reasons. Diet, a Western junk food diet, a Western soft food diet that isn't a natural diet can cause the body to be very, particularly the blood, to be acidified. Blood's mainly around 7.3ish, but as you get older the blood acidity drops on the pH scale. And the body has to counteract that. And if you're eating a very acidifying diet, then that alkalizing substance has to come from somewhere, so it comes from the bones and causes osteoporosis. This has been observed in clinical research. Also, the lack of exercise, weight-bearing exercise, lifting exercise, really it causes problems because you are supposed to move and you are supposed to work your body. If you don't work it, it's like a muscle. If a muscle isn't working, it atrophies. If a bone isn't working, it deossifies. It becomes disintegrated with holes in it. And it becomes brittle. And particularly older people, they end up with hip fractures and brittle bones. So part of the remedy for osteopenia, which is the space before osteoporosis, when holes begin to appear in the bones, is exercise. Lots and lots of exercise. One of the great ones is bouncing on one of those personal trampolines. It's called rebound. Up and down, it's working. But also lifting, using that body, going to the gym, lifting, using your body. And aerobics too, because you have to get everything pumped around the body. You need to be at a good weight, a good weight. Supplements can help. There is a myth in allopathic and general medicine that supplements improve osteoporosis. Incorrect. Osteoporosis is improved by a better lifestyle, diet, and using the body in a strong way with the help of some supplements. And of course, vitamin D. Vitamin D. So see a medical nutritionist who deals with plant-based diets. And again, I'm going to come back to plant-based diets, as I always do, because this is more alkalizing of diets, whereas animal-based diets are very acidifying to the body, which of course is causing the bones to lose more minerals to fight that acidity. So see a medical nutritionist who is thoroughly versed in plant-based diets and is also experienced as a physiologist. Take care. See you later.